Hi, my name is Anessa, and I'm the nurse that will be getting you prepped for your surgery today. How are you feeling? I'm happy to tell you that you are in the best hands here. I see that we are set to remove basal cell carcinoma, which I can explain a little bit about. It penetrates the deepest part of the epidermis and creates lesions. And I know that might sound scary, but luckily we caught it in time and we'll get you all fixed up. In basal cell carcinoma, it almost never spreads, and while being the most common of skin cancers, this surgery has had the best success rate out of any. How did you first notice this? Did you see a dermatologist at any point? We have some of the best surgeons to perform this surgery. We have 2 different surgeons and a pathologist who will perform individually on each of the 3 stages of surgery. Luckily, all 3 stages will be able to be performed today. I'll go ahead and explain the stages. We will start off with stage 1, which will involve the surgeon removing a small slice of skin with a scalpel in order to test it, and this will include anesthesia. The surgeons want to remain as accurate as possible, so they will mark the area of your face, which will also have anesthesia on it, so you shouldn't feel anything. So we will then have a pathologist test this and deliver the results back to see if the cancer is remaining. If the pathologist does see some remaining cancer cells, they will then report back to the surgeon and they will provide more anesthesia and remove another thin layer. The surgeon will continue this until the entirety of the cancer is removed, and after that they will stitch you closed and bandage you up. The surgery can vary from 1 to 3 hours because we want to make sure that all of it is removed. The amount of time here will also be determined on how often the surgeons need to go back and re-examine the subcutaneous layer to see if they need to remove any other thin layers. After they bandage you up, please remember how important it is to keep the area clean and as untouched as possible. It is likely there will be some redness for quite a bit of time, but it will go away with time, so don't worry too much about that. In any type of procedure, there will be scarring. However, with extreme care for the wound, it is likely there will be little scarring. We also offer reconstructive surgery for scars here if you ever want to look into that. We need to set up a date for the follow-up appointment to remove the stitches and to determine if we got rid of the basal cell carcinoma, as well as seeing that you are healing properly. We would like to see you back here in a week. How does that sound?